It won't kill you, but you may wish you were dead. This is what the infected people with the chikungunya disease are saying. I know most of you have heard of this disease caused by mosquitoes. It is fairly new here in the States, but has been around for 62 years now. It was first identified in Tanzania in 1952 and has mostly remained within the sub-Saharan Africa, the Arabian Peninsula, and Southeast Asia for the past few decades, despite a few occurring cases from travelers returning to the States. It arrived in the Caribbean only in December and has already infected as much as 250,000 people there. There is now numerous cases of this disease that has appeared in the United States from travelers who have contracted the disease while out of the country, according to the Centers for Disease Control and Prevention. As of July 1st, 2014, a Birmingham area man, 2 residents of Colbert County, and 1 of Tuscaloosa County are the latest believed to have contracted the virus. The 4 cases are preliminary positive and have not been officially counted yet by the Centers for Disease Control and Prevention, according to Kelly Stevens of Alabama Department of Public Health. But the preliminary positives do represent positive tests for the virus. These 4 cases join an already confirmed case reported of a Huntsville woman who has already recovered from the disease. All of these cases involve travelers that picked up the virus in Haiti or other parts of the Caribbean. Dr. Mukesh Patel, a Birmingham infectious disease physician, treated the Birmingham patient and noted the speedy spread of the disease. It's a disease that wasn't in the Western Hemisphere until very recently, with the first cases detected just in December 2013, just 7 months ago, and it has exploded. Now, 10,000s of cases have been reported in the Caribbean, Central, and South America. But as of July 1st, there has only been 129 cases reported in the U.S. Paola Bleitenberger, director of the Tropical Medicine Program at the University of Miami, says she is sure the epidemic is more widespread than official numbers suggest, simply because the diagnosis is too difficult to detect. Most patients suffer from extreme joint pain for 5 to 12 days, making it hard for them to grasp things with their hands or put weight on their legs. The pain usually subsides by the 2nd week mark, but some patients continue to have sporadic bouts of joint pain. Once a person is infected, there is an incubation period of 3 to 7 days before symptoms start. The common signs are fever, joint pain, typically in multiple different joints. Like any virus, it can cause muscle aches, headaches, rash, and joint swelling. While some patients suffer only mild symptoms that dissipate in a week, others have really high fever and joint pain that can last several weeks, even months. In fact, in the Makonde language, the term chikungunya means to be bent out of shape, in reference to the virus' ability to cause people to contort in pain. Here are some tips from the CDC to avoid bites. You use air conditioning when you can, window and door screens to keep mosquitoes outside, help reduce the number of mosquitoes outside your home by making sure you have no water pooling up or in containers. When weather permits, wear long sleeves or long pants, and always use your insect repellent. And if you're using sunscreen and insect repellent, always put your sunscreen on last. Put your sunscreen on first and your repellent on last. The main thing is to watch and stay away from mosquitoes.